How can you identify upper versus lower GI ulcer bleeding? Imagine you're trying to figure out where bleeding in the digestive system is coming from. The key difference between upper and lower gastrointestinal bleeding lies in the location of the bleeding source relative to a small but important structure called the ligament of Treitz. This ligament marks the junction between the duodenum and jejunum, which are parts of the small intestine. Bleeding above this ligament is classified as upper gastrointestinal bleeding, while bleeding below it is considered lower gastrointestinal bleeding. To tell them apart, doctors look at the symptoms and perform specific tests. If someone is vomiting bright red blood or material that looks like coffee grounds, it usually indicates bleeding from the upper gastrointestinal tract, such as the esophagus, stomach, or duodenum. Coffee ground vomit happens because the blood has been partially digested by stomach acids. Patients might also have black, tarry stools called melena, which result from blood being broken down as it passes through the intestines. These stools are often foul-smelling and sticky. Abdominal pain is common with ulcers in the upper GI tract. In contrast, bleeding from the lower gastrointestinal tract, like the colon or rectum, often shows up as fresh, bright red blood in the stool. This is called hematochezia. The blood may appear as streaks on toilet paper, coating the stool or in larger clots. Sometimes the bleeding is intermittent, and patients might experience cramping or signs of inflammation depending on the cause. Doctors also gather a detailed history. They ask about the nature of the bleeding, how long it has been happening, and any associated symptoms like pain or weight loss. Physical exams check blood pressure and heart rate to see if the person is stable or showing signs of shock from significant blood loss. To confirm the source, endoscopy is the most reliable test. An upper endoscopy, called an esophagogastroduodenoscopy, allows doctors to look directly into the esophagus, stomach, and duodenum to find ulcers or bleeding sites. For lower GI bleeding, a colonoscopy is used to examine the colon and rectum. Sometimes, a nasogastric lavage is performed, where a tube is inserted into the stomach to aspirate contents. If blood is seen in the stomach, it suggests an upper GI source. Blood tests like a complete blood count help assess anemia, and coagulation studies check blood clotting ability. Imaging tests like quart angiography or tagged red blood cell scans may be used if endoscopy doesn't find the source or if bleeding is severe. It's important to remember that black, tarry stools usually point to upper GI bleeding, but slow bleeding from the right side of the colon can sometimes cause melena. Conversely, bright red blood in the stool generally indicates lower GI bleeding, but very rapid bleeding from the upper GI tract can also cause hematochezia. In summary, vomiting blood or dark, tarry stools suggest an upper GI ulcer bleed, while bright red blood in the stool points to a lower GI source. Ultimately, endoscopy is the key tool to confirm where the bleeding is coming from and to guide treatment. If you or someone else experiences these symptoms, seeking prompt medical attention is essential. Always remember, each case is unique, so consulting a healthcare professional is the best way to get personalized advice and care.